So as we wait to get ourselves kicked off, I just firstly want to give a big thank you, big round of applause to the team who I've had the pleasure of working with, who I've had the pleasure of bouncing ideas off of, and just getting to be in collaboration with such an inspiring group of individuals. I'm so lucky. So I'd like to thank Christina Chen, Vivian Vo, Jonathan Liu, Dr. Marjane Moini, Dr. Angela Hasku, Esther Conrad, Dr. Maria Zlotnik, Dr. Irva Hertz-Pichotto, Dr. Kelly Sanders, and Dr. Amy Fajula. All right, next slide, please. Okay, so today's session will be discussing air pollution and wildfires and how we can center community voices as we discuss these environmental topics. So first, we'll be going through a brief introduction, which we're in the middle of right now. That will be followed by a roundtable presentation. Afterwards, we will break out into discussion groups, and then we'll come back to have a large group debrief on different action items we think we can take. Next. All right, so today we have Ms. Margaret Gordon and Mr. Brian Beveridge joining us from the unceded territory of the Ohlone people, Oakland. They will be in conversation with Dr. Marjane Moini. Dr. Moini is a radiation oncologist. She is on the board of San Francisco Bay Physicians for Social Responsibility and co-lead of the WOCAP Health Equity Advisory Committee, working closely with West Oakland Environmental Indicator Project. I'll kick it off to Dr. Marjane Moini. Thank you.
Thank you, India. It's really a pleasure to spend some time with Ms. Margaret Gordon and Mr. Brian Beveridge today. Ms. Gordon has been a lifetime community activist. She, as a single mother, she has worked her way off of welfare by attending commercial cooking schools. She has been a co-director of West Oakland Environmental Indicator Project with Mr. Brian Beveridge, who has more than 30 years experience in communication, beginning as a technical writer. We are going to start by Ms. Margaret introducing West Oakland and West Oakland Environmental Indicator Project.
Good afternoon, everyone. Can you hear me very clearly?
Yes.
All right. I am a third generational West Oaklander. And I've been involved in social justice since I was 16. I'll be 75 this year. I am been at the beginning of the thought process of developing West Oakland Environmental Indicators Project and developing the research and data uses for our issues and understand our issues and concerns of West Oakland. So as you see it on this slide, this is a historical history of West Oakland, and a lot of this stuff still pertains today. Only difference is not difference on this list is the bullet number 2. There's no longer a Cypress Freeway to divide the neighborhood. As of 1989, when the freeway fell, they rerouted the freeway out closer to the shoreline and into the Bay Bridge. Next slide. This slide is most geographic and demographic of West Oakland. We are a neighborhood between 3 freeways and next to an installation, a mobile source installation called the Port of Oakland, and connected to the Bay Bridge. And we do know that our children and our zip codes end up in zip codes of 94607, 94608, and 12, more likely between the ages of 0 and 5 end up in an emergency hospital for respiratory problems compared to children that live on the other side of the hills going towards Lafayette. Next slide. Our project is all about doing community participatory research before there was such a thing. We also has hands-on education. We are a community-based group, so we're always doing some kind of outreach, always doing base building based on an initiative, a plan, a design, or a program or a project. We also interject leadership development for residents first and others who need that type of support from other communities around environmental justice and the use of data and research. And we're always advocating. Advocacy is all through all our process programs. Everything we do is about advocacy. Next slide.
So,
Yes.
So we know that we need data for health advocacy. So the question we sometimes ask is what kind of research and what kind of data would actually best support health advocacy for the communities?
Our data has been based at either in the area of air, water, or soil, or health over the years. And how do you take the data and translate it into policy, and policy to be applied to an actual action? And that is part of the advocacy that we initiated over the years because of the cumulative impacts from air, water, and soil, and now another impact from the fires. We have another level, a new level of taking on the responsibility of what is that, how do we reduce that? What are the mitigations we need for this community of West Oakland?
I think maybe I'm supposed to jump in here. Is this me, Marjana? Is this where
Yes.
you wanted me?
Yes.
This is a little background on how we got where we are. This Paying with Our Health is a report that we did back in 2008 with our partners at Pacific Institute and some other folks, and was really trying to just take a very practical approach, saying it costs a lot of money for people to be sick all the time. And it was an attempt to put a cost on public health, not on human life, but public health. And so that was the beginning of just saying, let's try to talk the language of our opponents. If the business community wants to talk about cost, let's talk about cost, right? It's a lot cheaper to keep people healthy than it is to make them sick and try to fix them later. We realized that regional median measurements weren't doing the job to tell us what we were breathing at ground level. In the early 2000s, we had this theory that we weren't breathing the same air quality as other neighborhoods. Maybe just people up in the Oakland Hills, about 2 miles away, were breathing better air than we were. And so we had this notion that it's kind of like being at a party, a picnic. And if you're standing by the bonfire, you have a much different breathing experience than if you're over by the keg. And we realized a lot of our communities are basically standing by the bonfire. Right. They got a port, they've got a rail yard, they've got a refinery, and then all the people with a little more money are over by the keg. And so that really started to differentiate for us this disparity in exposure, and that we needed a different kind of data to really talk about this. Ambient data from regional air basins wasn't going to cut it. Next slide. We started to work with, we were lucky actually. We've been kind of lucky. Is there a slide between these? There you go. We've been fortunate actually. Serendipity has often, shown its face. And since we have had a kind of question in mind that was consistent, what are we breathing in our neighborhood on the street? What is the individual human exposure experience? We were able to respond to opportunities. One was when Intel Corporation came to us and said, what would you like to study? Because they were interested not so much in people or human experience or the environment. They were really interested in big data. This is 2008. It's hard to believe that, 2008, they weren't sure if a terabyte of data that hit their server would crash it. Now, Google gets a terabyte of data every second, and we don't think about it. but their interest was in big data, how to grab data, what to do with it. So we said, we want to study local air quality. So we taught people to carry these industrial dust monitors around on their backs in a backpack with a little GPS device attached to the side. And this is one of our earliest maps that showed the pathway of a resident walking through, this happens to be my neighborhood, walking through the neighborhood and collecting an air sample every second, or a measurement, not a sample, but a measurement every second of PM 2.5. Next slide. About 7 years later, that led to one of our board of directors, one of our members is a scientist at EDF. And he called us and said, would you be at all interested in this project EDF is funding, where this guy from the University of Texas named Josh Apte is going to work with Google Street View cars and put monitors in the back of the cars? And it was like, wow, 7 years ago to now, this is exactly what we want to do. It's exactly a project we would like to be involved with. And we immediately said yes, and we became the community partner in this, what has now become, or what became a landmark study of high resolution mobile air data at ground level. And so here we see every street in West Oakland was driven at least 30 times by the Google Street View car, collecting black carbon and NOx measurements every second. And this gave us a basis to say, look, people are not breathing stuff. Even within the 6 square miles of our neighborhood, there's a disparity of exposure. Some people along near these freeways, near the port, around this thing up in the corner, this little triangle up here in the upper left center is a big metal recycling center. It's over here, right on the word view. You can see a distinct purple and red triangle. There it is. Cast metals. They melt down old wheels and engine blocks and turn them into exotic aluminum that they sell to Tesla. And so we were able to take this and say, there is a disparity of exposure in our community. We need, just like we've said about the greater community, the greater region, we need to go to the places where the problem is the worst. We have a 6-to-1 ratio of exposure. Some people up here in the little yellow zones have 0.22 micrograms per cubic meter. Down here in Acorn, 175 micrograms per cubic meter. We need to go right there. There's like a 6 square block area. That's where we need to work, right? We need to go where the problem is. We need to go over by the bonfire and fix it so people aren't breathing so much smoke. So next slide. There's always been this idea of sacrifice zones, and it comes along with mostly climate change. But let's face it, for decades and decades, generation after generation, we have sacrificed communities. We have called them redlined. We have called them ghettos. We've given them all sorts of social names. But in fact, we have said, this is where folks like you live, and there isn't anywhere else where you get to live. And, all sorts of rules, all sorts of problems, all sorts of economic circumstance. And we say, well, that's where you get to live. And if you know anything about the Bay Area and you look at this map, for the most part, you know who lives in those red zones. Along the flatlands, right along the freeway and the BART tracks and the railroad tracks, over by the Port of Oakland, which is right there in the center. You can see where the 880 freeway, that's the Bay Bridge, comes across. And you can see those green zones up there in the Oakland Hills, right? So we have been sacrificing people for generation after generation by limiting their opportunity to live in better places, or by making the places where they live the worst places that you can possibly live. I mean, if you have a legacy in a neighborhood, your family's been living there for generations, maybe you don't want to leave. It doesn't mean you should have to live with all this pollution. I mean, I'm speaking to the choir here, I know. And so let's go to the next slide, please. I know we're on a short term here. This might have been a slide from Miss Margaret. I can't
Okay,
recall.
this is a slide of one of our one of our families, where is the family moved in one of the new housing developments, and the child had asthma so bad because the affordable housing that was built in this big complex was right, the affordable housing was right up next to the freeway. So they had to relocate this family because this family had asthma so bad. And we still have more families and more children at any given time in emergency hospital. And we still have at each school site, children bringing extra inhalers with their name on it and taking it to the nurse's office. Next slide. So as you see, health from PM and another thing that the air district really measure are cancer risks. They do not utilize asthma as one of the complications for having high PM. Next slide.
I would say that's something we probably need to work on. You know, cancer isn't that much so different from asthma. They say there's a lot of causes of asthma. There's all sorts of things, genetic and stress, and cancer, we're learning, is the same way. Genetic propensity, stress related, environmentally related, exposure related, all sorts of, you know, human behavior related. It's not so different from asthma. So why don't we use asthma as a reference for human health in exposure to pollution, right? Go ahead, Miss Margaret.
Next slide. This is a replica of how West Oakland has grown over the years from being mostly a wetland back in the day and has been infilled over the years to support this maritime process and the military process for over the years. So we have been that level of development for over the years. And now, because of the infill, we are more susceptible to a sea level rise at any given time now. Next slide.
Oh, can I say one thing about this slide? Yep. Interesting anecdote in a newspaper article I saw from about 1870. I can't point to it. I don't think you can't see Mike, but in this 1860 map, up here around right in the center left of it, an intersection. It's roughly at 14th Street and Market Street, which seems pretty urban right now. There was a newspaper article about a woman who had gotten malaria because malaria wasn't conquered in this country at the time, but it reflected that they were pushing residential neighborhoods out into these wetlands, which were, you know, natural, not swamps exactly, but they were very wet spaces, and there were a lot of mosquitoes around. And then at the bottom, you can see where the entire natural channel has been turned, an estuary has been turned into a channel with the military on both sides. At the bottom of that 1990 picture is the Alameda Naval Air Station, the Air Force Base, and in the gray area above it there is the old World War II Navy supply depot and Army supply depots that created the Oakland Army Base. And then that was divided up between the Port of Oakland and the City of Oakland. and remain a major logistics facility. Go ahead, next slide.
So as the effects of, we know that sea level rise is also based on who's going to be most vulnerable. And the closer you are to housing, housing is right up next to where the shoreline is. What are the vulnerabilities, and also what are the mitigations and preventions that should be applied to West Oakland? This is a demographics of a lot of the demographics and of what could happen to West Oakland if the sea level does rise, and who will be impacted.
I think this vulnerability, this isn't a comprehensive by any means. It's just some issues we came up with in talking to people in our community. It speaks to the fact that we often don't really recognize all the way one might be vulnerable, especially in emergency. If you think about a flood, you know, why is poor fitness? Well, you might have to walk for 5 miles. Remember Katrina? People walked for miles to get out of their communities because there were no buses. There was no way, there was no facility to take them anywhere. Born outside the US, why is that a vulnerability? A lot of people from other countries are not comfortable, you know, talking to the government. You know, in Central America, some immigrants from Central America are like, I don't talk to the government. You don't go anywhere near the government, right? That's the best way to, you know, get on the radar. You know, low income people, why are renters more vulnerable? They may not have any kind of insurance for when all their stuff gets destroyed. You know, people of no vehicle, you got to get out of the neighborhood somehow if you got to evacuate, right? So we often don't think about a lot of the factors that cause vulnerability to a disaster or an emergency situation. We only think about the big ones, right? Maybe I can't get out of my house or something, but there are a lot of factors that can make people more vulnerable.
Even with the gentrification of West Oakland, the new residents have not really adapted themselves to some of these factors.
Mm-hmm.
That how they're going to be impacted and vulnerable from the climate change or sea level rise. Next slide.
The last slide.
Yeah, you're
I
done
think
with
it
the
is the
slide.
last slide.
Yeah. So
There was something, Marjana,
yes.
could I
Go
offer one other thing? Because I think
Sure.
it's really important in today's world as populations are shifting and communities are changing. We often look at gentrification from one side, which is the community being harmed. We don't look at it from the side of the people who are moving in, and I don't like to brand people gentrifiers. They're just people moving somewhere that they can get somewhere to live. But you know what happens is when you have a sitting population, it's like, might sound weird, but one of the benefits of an isolated population, of a ghetto, is the people have high levels of social cohesion. When something goes wrong, they can rely on each other. You know, people used to hold rent parties. I don't have enough rent this month. I'm going to buy a bottle of vodka and everybody come to my house and you're going to give me $5 and we're going to have a party and I can pay my rent. Next month, I'm coming to your house and drink some vodka or some gin or something, right? People relied on each other and operated through these gray market economies because they were isolated. When you begin to take that apart and interject new people into this population who don't know anyone, and there's no welcome wagon anymore. Nobody drops by our house with a basket of flowers and some cookies. Those people are actually highly vulnerable, much more dependent on government services, which makes them much more expensive in the case of a disaster, because they don't even know their neighbor. You know, they live behind a gate. they don't know whether to go next door and say, can you help me out? Or let's inspect our homes, or you got anything to eat? I got something to share. So we are creating much more vulnerable communities when we don't have a process of embracing all the people who live in our neighborhoods. It's hard. It's a hard statement to make, that we should somehow embrace the people we think are ruining the neighborhood. But we actually have to build social cohesion, or else we all lose. The more people who don't know us, the less cohesion, the less support we have in problem situations. So I just wanted to make that. We don't talk about social cohesion much in the United States. They talk about it in Europe, they talk about it in Canada, they talk about it in Australia. It's a big part of their census questions. But we don't talk about this issue much. We're much more divided. We're much more troubled by our neighbors. We're much, and so we need to work on that, I think.
So we wanted to just find out what you think in terms of healthcare providers and healthcare systems, how we can best support people who are affected by climate change and air pollution and wildfires.
Well, I throw out one thing is, I think that healthcare providers and health systems have to be thinking not about how do I treat you because now you got an illness from somewhere. They have to be thinking about what is the nature of your exposure. They have to be, it's a little bit like industrial health. It's like, oh, you got sick in the factory. We got to go find out why. We have to look at neighborhoods the same way. Oh, you got sick. You live in that neighborhood. I need to be aware of the things you're exposed to. I need to be talking to my colleagues. I need to be pushing the data. We can't just be treating symptoms, because it's incredibly expensive to just treat symptoms. People with chronic illness that could be avoided. But first, the people who are in the health system have to be saying to everyone, inside their systems and to the government and the general population, we know people get sick because of where they live. We need to do something about where they live. I think this is a message that all health professionals have to begin to carry.
And also the social indicators of where you live, work, play, pray, and your surroundings also apply to your health. And over the years, they didn't even apply how does trauma internally or externally of your family affects your health and your being. Now with the wildfires for communities like West Oakland, that's another addition to the impacts that we already have.
It's funny, cumulative trauma and messaging, psychological messaging, right? We're not really at risk of a wildfire in West Oakland, but we're barraged by the messaging about the danger of wildfires, on top of all the real dangers that people live with in West Oakland, from crime to displacement to everything else. The cumulative burden of popular messaging around everything that there is to say about the entire world now. I grew up in a world where, unless it was local or you saw Huntley Brinkley talk about it on NBC News, it really, that stuff was foreign and local stuff was local. Now everything's local. Now everything is on our mind. I think we have to think more about the impact of the psychological burden under which people live and the effect it has. Because we know that depression has direct physical manifestations. So when we get to that point where our brain is making us sick because we're sad, we really got to start rethinking the way we approach care, right?
Thank you very much. We really appreciate the time you spent with us. Vivian is now going to go over the some rules for the breakout sessions.
Sure thing. Hi, everyone. Stina, can you share screen, please? So as we make our way into our breakout rooms, just as a reminder to the audience, feel free to chime in at any time. But we ask that you please stay muted while the speaker is speaking and until called on. The chat box is also available, and you can also raise your hand using the raise hand feature. For those of us who are joining today via phone, pressing *6 allows you to mute and unmute yourself, and pressing *9 allows you to raise your hand. Next slide. Moving on to our discussion norms. We hope that you will all be willing to try on new ideas that you might not be familiar with or prefer. And we hope that you will practice mindful listening and self-focus. And we encourage full participation by everyone present today. And now I'll let Jonathan introduce our breakout rooms.
Yes, so hey everyone. We will be having a little breakout rooms notes document that I'm going to put in the chat. So each of the student moderators will have. If folks are okay with it, we'll be taking some notes on some of the discussion and action items that arise. There's a link to that. There's also a tiny URL. But if you all can, if you're familiar with joining breakout rooms, I will be opening the breakout room shortly, but it will be in the bottom right corner. And if you can't find it, then I can assign you randomly as well. But if we go to the next slide. So we have 4 exciting breakout rooms today, and we're, one thought is to really be in conversation with everyone here, both with there will be a student moderator in each section, as well as these discussion leads regarding AB 617, research and policy, the mental health impacts of climate change, air pollution, and wildfires, wildfire preparedness, building community resilience, and community health clinics. So each of these is an option, and we have wonderful experts and discussion leads and community residents and expert bringing their lived experience to join these discussions. So, but we also invite you all to join in discussion. And with that, I'm going to open up all the breakout rooms. So everyone should have an option to join a breakout room right now. And I believe, hosts, participants, you all should already be assigned to the right one. But yes, please join, and we'll take 2 or 3 minutes to have that happen. I don't need to close them. Yes.
Jonathan, what breakout group am I assigned to?
I think they're in the process of assigning us now.
Okay.
Yeah, are we supposed to choose a breakout room or
I have no idea.
be assigned to one? I thought they were assigning us. Oh, I think, Margaret, I think you scroll down and you have this list in front of you.
I had.
If you click breakout rooms at the bottom, scroll down that list, you see the names of the breakout rooms. You can join the one.
Understand.
You can join the one you want to be in.
Oh, okay.
I think that wasn't clear. What can we do as clinicians?
On one, it says here is 86 research and policy.
Yeah, just keep scrolling. There's more breakout rooms. Health clinics, wildfire
All right.
preparation,
I see it.
health impacts. Just pick the one you like, and it says join next to the name.
You're right. Don't see my name.
Just click join. It'll do it
Oh,
automatically.
okay.
Those are the people who are already in the room. Rooms are all big.
Hi, everyone. Welcome back. Sorry for Mama D for cutting you off at the end, and I feel like everyone has been, yeah, that all of these conversations are so important, and they could go for much longer. And I hope this will be the start of a continuing conversation, and we will stay in touch. So now that we're back, we're just going to do a large group debrief about the things that we discussed in our small sessions. Yeah, I need to pull up the slide. But I think we can get started with the AB 617 group, and you can talk about just a few of the action items that you came up with in your discussion. So one action item, or takeaway rather, that Jonathan Pruitt brought up, I think was the fact that communities are able to make their list of priorities based on what research is done. And that leaves a lot of gaps as to what research has not been done. It's essentially a blind spot. And so that's oftentimes why individuals have a difficult time convincing people in power to provide funding for environmental-based projects. And so that's why in Stockton, they really jumped at the chance to be an AB 617 community so that they could have the resources to do the research so that they could then back up why they wanted this to be a priority. And so I think that us as health professionals, it's really important then to moving forward from this symposium is how can we support our communities in building this research and shining a light on those blind spots.
You're muted, Christina, for the record.
Sorry, yeah. Sorry, I was just trying to look for the presentation, but go ahead, Jonathan. I think we can just share out for now, just because we're running low on time.
Yeah, absolutely. So our breakout was community health clinics and what clinicians can do. And Ms. Margaret shared some important takeaways about building collaboration. In terms of addressing like health impacts, whether it's fires, whether it's air pollution, historical, industrial pollution, building collaborations with hospitals with large resources, the county, the feds, and the states, but most importantly, having the right people in the room, having the right people in the right community who have trust in the community, and not even just having them in the room, but really inviting them from the very beginning, asking and partnering and co-designing, rather than like coming with a design or with a plan. Other points and resources mentioned, thinking about like individually actionable data from Dr. Sarabu, and referencing the EPA Now Clean Air website. But the big thing is building collaboration that centers the community that's impacted. And with that, maybe I can popcorn it over to Vivian.
Yeah, of course. So I was in the breakout room for wildfire preparedness and building community resilience. And Irva and Matt shared with us that one of the biggest issues is that we don't know enough. There are long-term effects that we don't know about exposure to wildfires, and setting expectations is difficult because communities will identify a problem, but it's hard for us to researchers to explain it. And so that's where research needs to work on, because communities want to understand what they've been exposed to. And that's one way that researchers and institutions can support advocacy. And then some other topics that we talked about was that we need to escalate awareness and commitment to do something about global climate instability. And communities and institutions need to work together, such as through funding climate resilience centers first and having public health allies with our communities. And I will popcorn to Christina.
Thank you. Yeah. So in our group, we were discussing the impact of air pollution and wildfires on the mental health of the communities. I think one emerging theme that was very clear was that we really need education for the communities affected by wildfires, both in terms of just knowing where to go, knowing having very clear communication of when things are going to start and end, giving people the giving people language access and being able to really reach out to communities where they're at. I think education was a very important thing. The other part was also, we talked about the destigmatization of mental health issues, and to be able to talk to communities in the language that feels acceptable to them, but also still getting at the ideas of that all of these are very difficult for us emotionally and mentally, and how to reach out for help. And I think that there has been so much incredible work that Mama D and Violet has done on the community level with regards to reaching out to communities. And I think that having healthcare professionals really partner with community members is very important to move forward and to make that connection. And I think people also mentioned having more mental health tools for communities impacted by wildfires. Also, Dr. Ellen Herbst talked about the consent, like the ways in which how different communities are impacted in different ways, and really trying to address the needs of the most impacted communities, but also thinking about the long-term impacts and the impacts of people who are also in this environment, but might not have been directly impacted by wildfires, and also just needing more disaster and trauma-informed mental health professionals here in California, and advocacy for that, and for clearer communication from our political leaders. Yeah, thank you everyone for sharing all of that. Originally, I think we were going to share a slide with regards to summarize everything, but I think just for the sake of time, we'll probably be sharing all of the findings and insights with everyone through an email, follow-up email after this. But for now, we do have a few concrete action items that we can all take right now, like today, to advance environmental justice and health equity. And so the first one that the first action item we would like to share is this petition urging health and life insurance companies to divest from fossil fuels. This was an initiative that was a petition written by Vivian. He was here, and Vivian, if you could just share the link to the petition in the chat, then people can take a look at it afterwards and sign it.
Got it, I'm putting it in.
Oh, awesome, thank you.
I just dropped the link in.
Oh, thank you so much. And then the second one is signing a letter to encourage the California Air Resources Board to establish a stronger public health framework and meet the dual goal of reducing carbon emission and co-pollutants in environmental justice communities, and rejecting false climate solution advanced by the fossil fuel industry. And this is a letter that will also be shared in the chat. And then third, there is another petition written by Dr. Rupa Maria to stop Line 3, which is a pipeline that would run across indigenous lands and also threaten the health of the communities surrounding it. And then finally, today and also tomorrow is there are a lot of climate strikes going on, youth climate strikes going on currently. As we're speaking, I believe Youth and Versus Apocalypse, as well as several other young youth climate justice organizations are doing a climate strike in San Francisco. So just visiting your local youth, visiting this website and supporting your local youth activists as they're doing this important work. All right.
It looks like Miss Margaret had her hand up.
Like one of the missing links that has not been connected here, the dots been connected here. What is the training, the need for training, orientation to be able to approach community amongst yourselves? through the process, either process of having community participatory research guidelines, citizen science type guidelines, environmental justice guidelines. Those things are missing. Community engagement guidelines. How do you approach this? And I think that that is one of the key points for collaboration and coordination, that you got to have, somebody got to be trained and orientated to becoming, you just can't pop up. Because if you pop up, it's gonna be a problem. Somebody got to have all those approaches. And as right now, that is not being facilitated, needs to be facilitated. As y'all keep thinking about, want to be involved with community. But where's y'all's lessons? Where is the curriculum? Who is doing this for the future or for the next phase of your education? Who's doing this? Everybody don't have that skill. All y'all don't have that skill. All your teachers don't have that skill. All your professors don't have that skill. So the coordination and collaboration also comes along with partnerships with people who do have that skill.
Yeah. Thank you for just emphasizing that. And I don't think our training is doing that right. And I don't think everyone is at the right spot to engage right now.
And I'll add one more thing, which is to recognize that we were all trained in college to collaborate, and especially in medicine and in the public health world. But there comes a time where collaboration becomes collusion. And I can't tell you how many people sit in a medical chair on a governing board for a Valley Air District or an Air Resources Board or a CPUC, and they all take economic analyses really seriously. They're all worried about hurting an industry by standing up for public health because they want to maintain their credibility with the other board members. That's not your role. You're not there to talk about, to be a new economics professor. We got plenty of unhealthy economics professors out there. Like when you use your medical background or your public health background to get into governance and get into leadership, you've raised your hand for a fighting chair. And there's nothing better that you could do than to resign in protest from that chair when it fails to consider public health and medical impacts of the choices that it makes. Like I'm astonished that the American Medical Association allows thousands of people with MDs after their names to sit idly by while decisions are made that negatively impact public health because there's a cost benefit analysis on economics and policy. And I agree with that. That should be great. There should just also be a complete set of books, right? And if we're not going to do the calculations on public health impacts when these governing boards make these decisions, then you're walking away from your oath as someone who works in medicine. And so these are, it's okay to stay in medicine and do medicine. But when somebody flatters you with the opportunity to sit in an important chair, you take it, you're taking a fighting job.
100%. I don't know if Christina that you wanted to end this off here, but
Yeah, thank you so much all for contributing those valuable insights. I think, that was actually definitely something that I feel like was very important to cover. And I'm glad that you, Ms. Margaret and Matt, that both of you brought them up. Yeah, and I think like right now since the 4 p.m. panel is coming up, I just want to close this off and thank everyone. I'm going to also just leave everyone with these ideas and reflection questions as you walk away from this session. What is one immediate action that you will commit to? What is one long-term action that you will commit to? What is one point of curiosity you would like to learn more about? And who or what organization you would like to contact afterwards and can work to, and how can you work together with that person or organization? And as Ms. Margaret just emphasized, like in what way will you will we be approaching them, and what way can we create an equal partnership and a respectful one, instead of like parachuting solutions to communities without listening to their voices. So I think those are just some of the questions that I would like to leave everyone with. And so now I just want to thank all of our community members. Yeah, and we've worked with so many amazing organizations during this through this planning event, and so I would specifically like to thank Ms. Margaret and Brian from West Oakland Environmental Project for their presentation, as well as our discussion lead, Jonathan Pruitt from Stockton Catholic Charities, Matt Holmes from Little Manila Rising, Violet Sena and Mamadi Uhila from Climate Resilient Communities, and Dr. Cheryl Ho from the Valley Homeless Health Care Program, Dr. Tamara Montecute from the Arbor Free Clinic, Dr. Ellen Herbst from the UCSF and San Francisco VA Medical Center, and Dr. Irva Picciotto from UC Davis. And other than the speakers and discussion leads we have here with us today, we will also like to thank Gabriela Valencia from the North Fair Oaks Community Alliance, as well as Dr. Stephen Richmond and Dr. Tam Wodesus from Roots Community Clinic for contributing their valuable insight and experiences into this planning process. And so this session really would not have happened without all of you. So thank you all so much.